A really important scam to tell you about this morning. It started a few years ago with phone calls from people who claimed to be FDA officials. Now the callers say they're from the Drug Enforcement Administration.
Their targets are Americans who buy medicines online. As correspondent Elaine Quijano reports, they're being threatened by the imposters until they give up cash.
When someone calls and says, hey, we're with the government, and now we're going to potentially arrest you unless you pay a fine, there's certainly some fear there. And they would much rather pay that fine and keep their activities hidden from their other loved ones.
Agent Scott Collier works for the DEA, one of the agencies at the forefront of tackling a serious and ongoing problem.
During our investigation, we have logged well over 4,000 calls from individuals who have called us to say, hey, someone has called me alleging to be a DEA or an FDA agent.
It works like this. People seeking drugs find outfits online and either order over the phone or via the internet. No prescription needed, but definitely cash. Drugs can run up to $500.
Typically, we see folks trying to buy narcotics such as hydrocodone products, trade name most common is Vicodin, benzodiazepines, which are anti-anxiety drugs such as Xanax or Valium are very common, and also some diet medications such as phentermine.
They fork over their personal information, and that's how authorities believe those who run these sites get information and then...
When these phone calls begin, the person will identify themselves using a false name as a DEA or an FDA agent. They will claim that they have evidence that the individual has purchased drugs illicitly via the internet.
Which is what Daniel Sirik believed happened to his wife Carolyn after she purchased diet pills online.
She was getting a lot of calls on her cell phone, on her iPhone, and I'd say, who's calling you? The thing would be going off all the time. She says, oh, just somebody advertising. And, that concerned me.
His concern was justified. Daniel believes Carolyn was a victim of egregious extortion, and the consequences were tragic.
Her car was in the driveway, and when I walked out there, I saw her laying alongside the shop towards the back, and I thought she may have just fell and got knocked out.
But as he got closer, he realized his wife had been shot.
So I ran across the street to the neighbor, and he called 911. And then when we both walked back to her, and then that's when I seen her pistol laying there in the grass.
She had taken her own life. After her death, Daniel found messages on Carolyn's cell phone.
The man said, Carolyn, you need to call me. This is Lieutenant so-and-so. I don't recall what name he used. And so I called the number. He says, this is about her drug charges. And I says, what drug charges? Well, I believe that she was being extorted.
It was more than one phone call, and he believes the pressure was too much.
One victim who paid a total of about $85,000 over a period of time. They never asked for that much up front, but once you make one payment, it's quite common for them to keep calling. Because again, it's blackmail.
The problem is so pervasive, the DEA and FDA have combined efforts.
As we began our investigation, as we began moving along, identifying suspects, et cetera, then we began to cross paths with the FDA because they had been receiving similar calls from other victims across the country.
But for victims like Carolyn Sirik, it's too late.
Life changed in a heartbeat. I cried for 2 months straight, every day, all day. It's just something you hear about, but you never think it happened to you.
Elaine Quijano, CBS News, New York.